Actually, first thing I was curious about is just how our vaccination efforts going this week.
Yeah, I mean, they just started really today. I mean, we've got 900 doses going out today. No, that's not the right form. Sorry, I have a desk full of notes. I think it's around 900 doses going out today, and another like 900. I think that's what I said the other day, about 900 also going out on Friday, except I think Fridays are mostly Pfizer doses going out to people who received our Pfizer allocations from three to 4 weeks ago. So, I mean, it's been going on long enough, Jared. It's like clockwork. Everything pretty much functions pretty well out there. In fact, I mean, I don't even go there. We've got a team of people there, about 8 to 10 staff, and then we've got 40 to 50 volunteers who show up, day in and day out, and they just help knock it out. So it really is it's really a well-oiled machine right now.
Yeah, and so that's about what the volunteer base is right now, like 40 to 50 people doing volunteer work.
No, that's how many we have there at any given time. But we've got a volunteer base of over 100 people. I think when we first started, we had our volunteer requests go out, and I think we had close to 150 people on that list. And so the way that works is every time we've got an event going on, we send out notice to the volunteers several days prior, and they go in and sign up for the slots that will work for them and the workstations that they like to work at. And so, yeah, that goes out to all of the volunteers on our list, and they just they go in and fill them up pretty quick.
Gotcha. And what all do you guys have them doing in terms of the volunteer work?
Yeah, so they will help with the actually. So we have a person who basically welcomes them when they come in, and we check to make sure that they have their identification with them. As long as they show ID, some form of identification, then we send them down to the registration table, where we've got anywhere from 2 to a half a dozen people helping out at that location, where they actually make sure that they have a time slot to come in, make sure that they're not there too soon. If people get there too soon, we'll have them take a seat and wait, so that we do spread out those people coming in. So we've got that volunteer who's helping basically welcome them, check their identification, make sure they're not there too soon. Then we send them down to the registration desk. Then we've got people who help just kind of guide people through the whole rope setup. Then we've got people who do kind of a check and balance with their check-in, making sure that they don't have any indicated complications from previous vaccines. And as long as they're okay, if they have had a complication, then they talk to one of our nurses and they talk them through, because generally we don't want people coming through a mass vaccination clinic who might have had previous complications from a vaccine.
Right.
So we confirm that. If they've had allergic reactions to vaccines, we'll send them probably to their physician's office or back to the hospital to get their vaccine. If they just had, mild symptoms from getting their first dose, then we'll go ahead and route them through. Then we have people who start, they give out the cards. Right. I have one sitting here, but they start the card, or they'll sign off on their second dose. And then we've got people who are actually administering the vaccine. We have people that are filling the syringes with the appropriate vaccine allotments. Then we have people go to the second dose workstation if we have people coming through for their first dose. So we have about a half a dozen people who work at the second dose scheduling station. And then we have volunteers that also help with just monitoring people as they wait their 15 minutes. And then we have people that help wipe down chairs. And then we have a whole nother set of people off to the side that help with data entry that goes into the state database for, we have to go in and enter that information on a timely basis so that the state can review how many doses we've given out versus how many we've been given. And so we've got volunteers. Again, it takes a lot of volunteers, but they're all through that entire place. Oh, and then we've got some runners. So just general people to help get a coffee or get a water or bring a cookie, something to snack on, that sort of thing. Because our clinics will run, either 3 to 6 hours a day.
Right, right. And I'd imagine then with some of those different tasks, or maybe all of them in some ways, there was a lot of training that had to go on the front end, correct?
Yeah. So all of those volunteers, number one, had to receive their vaccine.
Right.
For the most part, I believe. And then they had to come in a day before their first shift and, of course, get training. If they're coming in for a different workstation where they're going to be working where they haven't been before, then they always arrive an hour early to make sure everything is set up, situated, any questions can be addressed, any updates can be provided. So absolutely, there's been a robust amount of training and continued training. Not only do we do training, but then after each event, at least we were for the first dozen or so, we would sit down after the event would happen and then also do what we call kind of an after action report out and talk about things that we can improve upon, things that we can change, things that we can get better. So we're constantly doing self-evaluation for in that clinic for ways that we can improve. So quality improvement, performance, quality improvement is something that we're always working on.
Gotcha. And I already know the answer, but still feel like I have to ask. Do you think you all would be able to do all of this without that much of a volunteer base?
No, I mean, we only have a staff of 45 people here. There is absolutely no way we could do that. Now, I should also point out that, we've got colleagues over at Mercy One who are doing basically the same thing, only they're using, I believe, for the most part, a lot of their own staff. And it's a smaller setup, but in a lot of respects, they're doing quite a number of people there. And so when you factor in the fact that Mercy One is doing quite a few doses for us, and then not only are they doing prime doses, but they're also doing boost doses for us. In addition to what we're trying to do with all the volunteers that we're using, there's no way. I mean, this is a community-wide effort, and certainly kudos have to go out to, the CG public health staff that are spending a tremendous amount of time down there, and also all of our amazing volunteers. I mean, they come in and smile, and they're just super nice and cheerful and happy to be there. And they're not getting paid a dime, except we just try to keep them fed. Right. And then what our colleagues at Mercy One are doing has been extremely helpful. And then, we have other, Hy-Vee One doing their thing. But anyway, so there's no way we could do it without the volunteers that we've had step forward.
Right. And you kind of spoke to this a little bit before. So are there some of those folks that are volunteering just pretty much constantly every single time that you all need them?
Yep. Mm-hmm. Yeah. I mean, there's people who haven't missed one. And they count them. I mean, they literally have not missed a single. I don't know what number we're at, Jared. I think we could be getting close to our 30th clinic. And so, these people come in every single day and help us out again with a smile and with appreciation, and really with just a simple token of thank you from people as they come through.
Sure. And I was curious too, this is more of just a little bit in the weeds, but what's kind of the age range of folks that are volunteering? Is it mostly older folks or some younger folks, or what's the spread there?
Yeah, that's a good question. I would say when we were doing Saturday clinics, there were people who might be, I'll call more my age. I would say, I mean, I'm getting close to 50, Jared. I'm getting to be an old man, but there was people, there might be people there who work during the normal week who might want to volunteer during weekend shifts. But I would say it's a mix. We have people from, I would say in their general, maybe late 30s all the way to full retirees, whether it's retired doctors or nurses. We've got a tremendous amount of doctors and nurses that are helping out with filling syringes or actually administering vaccine. Yeah, so it's a pretty good spread.
And even with all this said, is this one of those kind of things where you all would always be happy to take more volunteers if people are interested in volunteering still?
Yeah, I need to check with, so Elise DeVries is our staff person who kind of oversees and helps with the scheduling of those volunteers. I want to be careful. I don't want to put out an APB asking for a whole bunch of volunteers if we're not there. Right now, I think we're okay on volunteers, but that is something that we do want to monitor. We don't want to wear out our volunteers or feel like they have to show up. I think once we get to that point where if we do need additional volunteers, we'll reach out.